Hi everyone, my name is Mia Harris. I'm doing my second case presentation on hypomagnesemia in response to a flashcard presentation by Alicia on hypomagnesemia. Alright, I'm just going to get right into the case presentation. So, hypomagnesemia is a serum magnesium level less than 1.7 milligram per deciliter or less than 0.85 millimoles per liter. So the normal level for magnesium is 1.7 to 2.2 milligrams per deciliter or 0.5 to 1.1 for millimoles per liter. I'm going to get right into the case presentation now. So we have Mr. Matthews. He's a 50-year-old male. He's married with 2 teenage daughters in high school. He works as a chef in a 5-star restaurant. Mr. Matthews was diagnosed with type 2 diabetes about 10 years ago and has been on metformin 1,000 milligram BID. Mr. Matthews also started drinking alcohol 5 years ago due to job and family stressors, and his alcohol consumption has gotten worse over the years. Mr. Matthews has not been feeling too well lately and decides to go to the hospital. In the ER, he presents with complaints of persistent diarrhea, passing loose stools 2 to 3 times a day, abdominal pain and cramps, muscle pain, muscle spasms, and weakness, particularly in the legs. He was also experiencing tingling or pins and needles in the lips, hands, and feet as well. Nausea and vomiting and loss of appetite also. Upon physical assessment, Mr. Matthew was found to be tremulous, had an elevated blood pressure. He was confused and distracted during the assessment, and his serum magnesium level was 1.1. It was 1.1 milligram per deciliter or 0.65 millimoles per liter. Diagnosis tests that could be ordered for Mr. Matthew in this case again will be a comprehensive metabolic panel or an EKG. Magnesium affects the muscles, which also includes the heart muscles as well, so EKG will be appropriate to order as well. The complete metabolic panel, also known as CMP, is a test that is done to test various labs values and electrolytes in the body. So these are just all the labs that are tested with CMP and the normal values. And again, I'm not going to go through all of this, but this is just to have for reference. Yeah. I'm going to just skip down to the next section here. So it says, based on all of this, what is your diagnosis and why? So in the case of Mr. Matthews, his serum magnesium level is 1.1 milligram per deciliter or 0.65 millimoles per liter. Mr. Matthews is diagnosed with hypomagnesemia. Hypomagnesemia can be caused by diarrhea, excessive urination, or poor magnesium absorption through the GI tract. Mr. Matthews has type 2 diabetes, which can cause excessive urination. He is also prescribed metformin for the type 2 diabetes. Metformin causes diarrhea, nausea, and vomiting as a common side effects. The exact mechanism is unknown, but it is believed that metformin alters certain chemicals such as serotonin or histamine and the normal flora in the GIs in the body. The normal flora are just like bacteria and viruses that already lives in the gut that helps to regulate digestion and things like that. So when metformin alters these normal flora, it can lead to diarrhea. Mr. Matthews is also an alcoholic, and chronic alcohol consumption causes hypomagnesemia as well. Alcoholism is associated with necrosis or cell or self-death in the GI tract, which can lead to poor intestinal absorption of magnesium and other electrolytes, and can also which can also lead to diarrhea as well. Alcohol also causes impaired liver function due to liver cell death. This can lead to hypomagnesemia there. I'm just going to erase that and just write hypomagnesia. Yeah. This can lead to hypomagnesia because the liver cells are responsible for processing and maintaining normal magnesium level. As stated above, Mr. Jones also presented with all the signs and symptoms of hypomagnesemia. So how can this be treated? Hypomagnesemia can be treated with magnesium supplement by mouth if the hypomagnesemia is mild. Magnesium can also be administered by intramuscular. Can be also be administered intramuscularly or with IV fluids, usually 5% dextro or water through the IV for moderate to severe hypomagnesemia. Mr. Matthew has a case of severe hypomagnesemia with levels of 1.1 milligrams per deciliter or 0.65 millimoles per liter. So he will most likely be treated with IV fluids containing magnesium. So this is the end of my presentation. These are my references, and again, feel free to print out the template and just read it for more clarity. All right, thank you. Have a nice day. Bye.